Hello everyone, I am Dr. Karthikeyan, consultant pediatrician. The purpose of this video is to clarify some of the doubts concerning painless vaccine and ordinary vaccines in babies. Many parents feel very anxious with vaccinations for their babies. When they first go to the vaccination at 6 weeks of the baby's life, they are usually asked a question by the pediatrician whether they want a painless vaccine or an ordinary vaccine. It's quite difficult for parents to choose between the two. Now let me explain some of the scientific facts between a painless vaccine and ordinary vaccine. So first, about painless vaccine. Strictly speaking, they are not entirely painless. So these vaccines causes less pain and less fever. The advantage of this vaccine is that they are much more gentler on babies. It causes less pain, less swelling and pain at the injection site. Less episodes of crying and feeding difficulties after vaccination. It also has an important component called as injectable poliovirus, commonly called as IPV, which is much superior to the oral poliovirus which is being used currently. The downside of this painless vaccine is that it is expensive. If you look at the wholesale vaccine or the ordinary vaccine, they are much cheaper, but the downside is it's slightly stronger in potency when compared to the painless vaccine. So it causes much more fever, more pain and swelling at the injection site, and babies tend to have episodes of crying and feeding difficulties for a few days after the vaccination. Another downside is that the ordinary vaccine does not contain IPV, and this has to be given as a separate injection if the parents want to give injectable poliovirus. Now, how do parents decide between these two? The Indian Academy of Pediatrics, which is the advocacy group for pediatricians in India, suggests that babies can get a painless vaccine in the first year of life because they are gentle on babies. The same vaccine has to be given as a booster at 18 months and again at 5 years of life. So during these two visits to the doctor for vaccinations, parents can ask an ordinary vaccine to be given, as the ordinary vaccines have a slightly stronger effect and the immunity lasts for a slightly longer period of time when compared to the painless vaccine. By using this strategy, one can get the best of both worlds. For example, the painless vaccine can be given at 6 weeks, 10 weeks and 14 weeks of the baby's life. These are much more gentle on babies, although they are expensive, and the ordinary vaccine can be given either at 18 months or at 5 years in order to confer a slightly higher degree of immunity and a longer period of immunity for babies. So hope this explanation will help you to make an informed decision about vaccinations for your baby. If you need any further clarifications, you can contact us at 044 485 77331. Thank you.